Thank you, President. My adjournment matter is for the Minister for Mental Health. This government has just announced a $13 million spending on temporary mental health centres across Victoria. This is part of a broader $22 million of spending, which itself is part of a $3.8 billion outlay, the mental health budget. We met with the Health and Community Services Union to discuss the current situation in the mental health industry. Mental health practitioners and frontline workers haven't seen pay increases for years. New workers' training is restricted, and we aren't able to import mental health practitioners through immigration. Professionals are leaving the sector, moving to higher paid work in other states or other fields. Mental health providers were already working at capacity. New facilities that have been built have taken over a year to get fully staffed. Mental health professionals don't just appear from thin air when you build facilities for them. You cannot create a professional workforce overnight by throwing money at it. It takes years with dedicated training resources and then a pathway from education to employment. This $13 million is intended to fund 90 dedicated clinicians. Where are you getting them from? Unless you're secretly cloning an army of healthcare workers on a distant star system, the people to fill these jobs just do not exist. The truth is that this expenditure is just another publicly funded media opportunity. The Minister you get to say you care about mental health to the tune of $30 million. You get to put a nice headline on a media release and attempt to spin the story away from the damage to mental health the ongoing lockdowns are creating. The only way the government can address this shadow pandemic is by addressing the cause, the harsh and overly restrictive lockdowns. It's no surprise that people are unhappy and that mental health problems are becoming more common. Misery is official government policy in Victoria. Your government is isolating people, destroying their support structures, taking away their income and mortgaging their future. You have used fear and force to shut down dissent and to mandate compliance. You are causing this mental health crisis and you cannot fix it by throwing money at it. Worse still, the money you're throwing at it is money you're taking from the people you claim to help. There are no new mental health resources to put on the table. You are just shifting the existing cards around and hoping that no one is watching closely. I call on the Minister to actually address the growing mental health crisis by reducing the negative impact government is having on the lives of Victorians.